Coming up tonight on The Experience, it is time once again for the Clark High School basketball tournament. We're going to tell you all about that. But first, we begin with Dr. Johnson and talking about a program that is at UMass Memorial and talking about IVF, in vitro fertilization. And Dr. Johnson, thank you so much for being here.
My pleasure.
So tell me a little bit about IVF. Give me the Reader's Digest sort of starter course on what we're talking about.
Yeah. Well, sadly, about 1 in 8 couples have difficulty achieving the family that they want to have. And back in the sad days, back when I was in training, we really didn't have any treatment that would help them. But now we have a treatment that succeeds about 35 to 40% of the time in helping a couple have a baby, and that's in vitro fertilization. And basically what we do is we just give a woman medicine to help her stimulate her ovaries to make eggs. We take the eggs out, we put them in a little laboratory in a little petri dish, we add the men's component of that, we grow these little embryos for a couple days, and then put it back in the woman, and she becomes pregnant.
Amazing, amazing. Now, but that what you just described doesn't seem new to me. That has been around for decades, or that is new?
Well, it's been around. The woman who was the first IVF baby, Louise Brown, was born 40 years ago.
Right.
And so it's been around, but the science behind it was not very well perfected until fairly recently. We had no way to treat men who had decreased sperm issues. And so we really found ways of optimizing chances for couples achieving their family goals.
Okay, so I just wanted to stop you there, but just because of you mentioned the man. So I come to you with my wife. Is that the first step you're going to find out? Because I would think that there could be a variety of problems then. And some of the problems may present more challenges than other for IVF?
Yeah, and actually it's true. If you look at the causes for not being able to achieve their family goals, 40% are because of the woman has a health issue, 40% are the men, and 20% are what we call unexplained. So we don't have a reason for it. And so it's kind of mixed between men and women.
If it's unexplained, can you still use an IVF treatment? Is there something that would disqualify you from using an IVF treatment?
No, it really works for virtually now. It really works for all causes of fertility and desire for pregnancy. At one time it didn't, but now it does.
Is it when someone comes to you, is it kind of a first step, or are you trying other things first before you go to in vitro fertilization?
Well, typically what they do is they try for a year. That's the standard. And if they don't achieve the pregnancy they're hoping for, then I would see them and I do a really basic evaluation to look if there's something with the husband, something with the wife, or again, if it's the unexplained. So we do a very basic workup. It only takes a month to do that. Then there are other treatments. None work quite as well as the IVF, but there are other treatments. We discuss those options, and then they decide what they want to do.
All right. So within a year, most healthy, normal couples, if they are trying, will be able to become pregnant.
Yes.
Unless they're really doing something wrong. Do you tell me, I don't know, is there a basic where you say, hey, let's just talk about this, let's just make sure that you're doing everything that you can, right time of day, month, temperature, all the things that you see on the TV shows from time to time?
Yeah, actually, it's hard to do things wrong, and virtually all couples do it just fine. So, yeah, and it's interesting because when couples come, they're usually to the point where they get pretty frustrated. It can be really, really stressful because to try for a whole year and you see couples around you getting pregnant easily, that can be really tough.
Is there a mental component to this as well that is part of the treatment? You just talked about the frustration of seeing other people happy. All of a sudden, everything reminds you of having a baby, and particularly if you're trying and you can't. But even if you're going through this treatment, are there things that, because it can be stressful, that there is a component where there's a psychologist or a psychiatrist or somebody who is just taking care of your peace of mind?
Yeah, I do think, We don't think that the stress causes infertility, but infertility, not being able to achieve pregnancy, definitely causes stress. And we do have a psychologist who works in our office and talks to couples because it's one of the most stressful disorders there is. Some studies even show it's more stressful than cancer.
I can I can just imagine, again, just because there are really those constant reminders everywhere, and what a terrible thing to be going through, that you can't be happy for a old college friend who is pregnant, or somebody else in your family. So what exactly is the program? So it's been around 40 years. What then is new about what you're doing and what's happening at UMass Memorial?
Yeah. Well, it's a good thing that it's grown and developed over the years. I started my education about 35 years ago. Really, at that point, it was just beginning. I came to New England. I was at the University of Vermont before I moved here 10 years ago. Back then, the pregnancy rates were less than 10%. They were only about 8%. And over the years, what happened is the people who run the lab, I wish I could say it was the physicians who learned how to do it, but it's the people who run the lab. They're called embryologists. They learned how to keep the eggs healthy, keep the sperm healthy, keep these cute little embryos that are growing and develop healthy. And they learned how to do that in such a way that the chances for success are now very good.
Yeah, so, wow, 8%. But now what did you say it was, about 35?
35 to 40%, depending on, mostly, and not to put too much of a focus on it, but the older women get, the lower the chance for pregnancy.
Right. Well, and you hear about people freezing eggs and different things as well. 35, 40%. If it doesn't work the first time, do you try again? Is there a risk if you try more than one time?
That's a great question. Yes, actually, you can try again, and people will. And the good thing about Massachusetts is this treatment is covered by insurance, and most insurance will cover it up to 4 times, and some even more. Now, the other good thing is now the little embryos that are of good quality, if you grow several and put back one, we only put in one, we try to avoid twins when possible. We put in one, then good quality ones can be frozen, and that gives a second chance for pregnancy. I saw somebody earlier this week who, she and her husband now have their second baby from their first IVF cycle.
Oh, no kidding. Oh, interesting. That's wonderful. So somebody who is watching right now, and they've been trying, and they've had some trouble, what would you suggest is the step for them? To get in contact with you, get in contact with UMass Memorial?
Yes, they should. That would be great. You can tell that it means a lot to me to help these couples.
Yeah, this is really interesting. Tell me a little bit more about your story, because really you got in right away. So 35 years ago, I mean, this has now become your life's work. It seems as if it is a real calling for you to help people. What drew you to this?
It's true. When I started out, most of what we did, we didn't have a good treatment. We would do surgery. We would try medications. We tried so many things, and sadly, not many things worked. And so I've watched it develop over the years, and it has meant a lot to me to see it now be successful. I had the privilege of meeting the first IVF pregnancy, Louise Brown. She's wonderful. She wrote a great book. And she talks about what it means to her to have seen what led to her life and what it means to other women, men, and children now. And so she and I had a great conversation about how much it means to help couples achieve their life goals.
What was that like when you had that conversation, or you met with her? How did that come about? And clearly, it's been inspirational.
Yeah, she came to a meeting. There is the American Society for Reproductive Medicine. That's my national society, and I was introducing her because she came to speak, and she and I had a chance to sit and talk, and I talked about, gosh, I was in medical school when, I first heard about you, and I was really inspired by how this could happen when it had never happened before. And we talked about it and what it meant to her and why she thought it was so important for her to be a voice for the importance of optimizing fertility.
Yeah, I have to tell you, one of the things that strikes me about this, though, is UMass Memorial, but just the central Massachusetts region. I think of us as being cutting edge because of UMass, because of the incubators for all of the down near where UMass Memorial is with that lakeside campus. I mean, I really think of us being cutting edge, and it seems as if we're a little late to the party here.
Oh, a touch, but we'll be there now.
Yeah.
We've been sending patients to Boston, and they do good care, but patients really want to stay with the doctors they know.
Right.
And it makes a world of difference. So being able to do the completion of the treatment right in Worcester, I know my patients have asked me many times, when are we going to get this going? And I say, I'm working on it.
Yeah. Over the 35 years that you have been involved, you've seen so many advances. What have been some of the ethical questions that have come up in that 35 years? And are those the same questions that are being asked in 2019, or have a lot of those questions been answered just with the passage of time?
Most of them have been answered with the passage of time. I mean, really, this is two members of a couple achieving their family. And there was some question of, is it okay to have an egg and an embryo in a laboratory, but they're maintained, they're healthy, they're cared for with great respect. It's interesting, not to talk about it from a religious component, but I've always found that most people I talk to are very supportive from all religious backgrounds and really see this as an important part of what their parishioners need in order to have the families that they desire.
But it's probably, so what percentage of the population is having trouble conceiving?
It's about 12%.
About 12%. So, you think over that time period in your congregation, in your family, you probably know somebody. There's probably only a few degrees of separation that you at least know somebody who knows somebody who is having that trouble. And it personalizes it, makes you, you want them to be able to succeed, as you said, in what they want for their family. Boy, we have just a moment left. Thank you. This has been fascinating. What do people need to know, or how can they find out more about the work you're involved in?
Yes, if they want the service, they're welcome to call UMass and ask for the clinical care if they need it. Also, if they're interested in helping us to build this IVF lab, they can get in touch with our advancement council, our advancement group, and call them. I'm happy to have them do that as well. And I'm always open to answering any questions that people have about this process. It's obviously a passion for me, and I'm very open with discussing it with anyone who wishes to talk about it.
Terrific. All the information is right there. Thank you so much for coming by and
pleasure.
talking to us. Much more to come right here on the Hank Stolz Experience.
My baby, what a lovely way of saying how much you love me. Having my baby